Everybody, good morning and good afternoon to those of you in afternoon zones and morning zones. Thank you for joining us for the first of our webinars and our discussions on building Africa's frontline readiness in the health tech sector and considering the legal and regulatory requirements for its success. I am Nankunda Katangaza, co-founder of the African Law and Tech Network, who are your hosts today. This discussion is particularly timely, but it was in fact a session that we were planning to hold live this month in Nigeria before we were overtaken by the pandemic. That, of course, made the issues even more salient, given the potential role of technology in managing the spread of the virus, and indeed to address some of the challenges that have arisen in response to the increased demand for medical equipment, for PPE, and the uninterrupted supply of other essential items, including food. Yesterday, President Ramaphosa of South Africa announced the creation of the Africa Medical Supplies Platform, a one-stop shop for the continent, which will operate via an online e-commerce marketplace. Definitely a welcome development, but certainly one that will require quite a great deal of technology to underpin it and to actually operationalize it, and to make it possible for everybody to benefit from what it offers. So technological innovations such as this one and others do come with particular challenges on a continent with low smartphone usage, expensive data bundles, poor power supply, and a lack of enabling regulatory and policy environments. Health tech and telemedicine were already fast-growing areas in Africa's tech journey. So the lockdowns we're all experiencing actually made it an opportunity for us to bring together a diverse group of experts and delegates from across the continent to discuss these issues, which would probably not have been possible before. So I'm not going to spend a lot of time on introductory points because I'd like us to kick off and listen to our speakers and our discussion. But before we do that, just a few housekeeping points. The panel discussion will last just over an hour and we'll then open up to questions. Please direct any questions and comments to the panelists via the Q&A tab at the bottom of your screen. You can also use a chat function, which will be moderated, but any specific questions, please via the Q&A. The session is being recorded and streamed on the Alt Network channel on YouTube, and we will share highlights from that on our website and directly to you in due course. So without further ado, I'm pleased to introduce our panelists for today. In no particular order. First, we have Wale Adeosun, who is a medical doctor and health management consultant and digital health entrepreneur. Wale has had experience providing technical assistance to development partners and governmental agencies on managing innovative ideas and technologies that strengthen health systems to improve outcomes, service delivery, and quality of care. Wale is a co-founder and CEO of Wellvis Health, a comprehensive telehealth platform. As a response to the COVID pandemic, his company created Wellvis COVID triage tool for COVID-19 infection risk assessment, education, and decision-making, as it provides the required safety education and measures, reassurance, and support for every individual who uses it. Welcome, Wale. We also have Cynthia Antwi-Dodoo. Cynthia is a senior technology for development consultant with over 15 years experience, and she works with organizations to design and scale technological interventions for health and social impact programs. More recently, Cynthia established Realfin Consulting Ghana to focus on providing digital health transformation services and consulting services for the private and public health sector in Ghana. Next, we have Daniel Batty, who is a tech law advisor at EndCode South Africa. Daniel's area of expertise include assisting tech startups to understand the legal and regulatory landscapes within which they operate. Daniel believes that emerging technology should be developed from a foundational human rights perspective and is most interested in the impact that emerging technologies such as drones, blockchain, and artificial intelligence have on foundational rights such as privacy, education, and the delivery of healthcare services, and the role that disruptive sectors can play in advancing or threatening those rights. Next, we have Yara Cumbi. Yara is currently the Health Information Manager for Pensa, a mobile health platform for health communication in Mozambique. and also a research assistant at the University of Chicago. Prior to that, she was a health analyst at ThinkWell in Mozambique. Yara has worked across an array of public health projects, including establishing a comprehensive approach to care for survivors of gender-based violence, evaluating Mozambique's national tuberculosis program, HIV/AIDS, primary health care, human resources for health, supply chains for medical commodities, and more. Welcome, Yara. Next, we have Ridwan Oloyode. Ridwan leads the privacy and data protection team at TechHive Advisory Nigeria. He's also, in addition to being a lawyer, he's also a policy analyst and researcher who has made recommendations to legislations, reviewed legislation, and co-authored policy briefs and working papers on the intersection of law and technology. His expertise also includes cybersecurity and data ethics, and he advises on aspects of global data protection and privacy laws, including regulation compliance, international transfer data, rollout of new technologies, healthcare, and global data risk management. And last but not least, we have Melissa Rusanganwa. Melissa is regulatory and aviation lead at Zipline, a drone service delivering vital medical supplies in Rwanda, which most recently set up also in Ghana. Melissa started at Zipline as public affairs lead to handle government affairs, and subsequently she's continued to solidify the relationships between Zipline and different government stakeholders and regulators to ensure smooth operations and to integrate Zipline's operations into the national airspace. Welcome to all of you, and thank you for joining us today. So the way we're going to do this is we're going to have a sort of moderated conversation. I'm going to ask a few questions, but really want to leave our experts to do all the talking. So I'm going to start off by asking, just having a look at the lay of the land, and I'm going to ask Cynthia to kick us off on that. Cynthia, can you talk to us a little bit about the technological innovations that we're starting to see in health sectors across the continent? And actually, if you can even start pre-COVID, what issues were the main targets in the health tech development in terms of advice? Was it advice and information, diagnostic, treatment, etc.? Could you give us a little bit of an overview of that, please?
Thanks, Nankunda. And good morning and afternoon to those who are on the call. Yeah, I think it's exciting times in health tech. Over the last few years, the health sector, especially in the innovation sector, has been growing steadily with a number of startups coming into the market and solving a broad spectrum of problems in the health sector. Pre-COVID, there was a lot of work around documenting or digitizing medical records, some work in diagnostics, and also in testing kits, and also just your general medical technologies. And I'm speaking more for the commercial sector. In the public sector, we had donors who were focused on specific areas, HIV, malaria, maternal health, and they were providing different technologies following a set of guidelines called the Digital Principles for Health, which really focused on harmonizing the type of solutions that were being provided across the continent. But specifically in the last year, or should I say 6 months, big organizations such as pharma and some funding institutions came together to provide channels for funding for different innovations. And I think some of you have seen the Tech Emerge program that has recently came out. They had over 600 applications. They selected 40, which covered a wide variety of services from technologies using intelligence and machine learning, point of care, medical equipment, maternal health, operational efficiency, supply chain. I mean, the whole gamut. So yeah, it was emerging. It was growing with confidence. And then fast forward now into the COVID era, we are now more focused on PPEs, telemedicine, as you've mentioned in your introduction, access to mental health services for healthcare workers, contact tracing, access to information, as has been mentioned by some of the providers or companies on this call. And so I think it has pushed some of the different services to the fore now in this COVID era. But yeah, it was actually gaining prominence. There was a lot of investment coming in. And yeah, I think it's going to grow even more now that we are in the current context that we face.
Yes, definitely. Thanks, Cynthia. Yara, I wonder if we could come to you to, looking very specifically at one country to talk about the implementation of health tech, if any, if at all, in an overall public health strategy. And you can certainly refer to Mozambique, but even your kind of wider experience of it and sort of any good practice that you've observed or not so good practice.
Thank you so much for having me. I'd like to talk about Mozambique. As it stands right now in terms of health tech, most of the interventions are more in the sense of health information systems, health management systems. They're very much internally looking in terms of the health sector. In Mozambique, we have 5-year and strategic health sector plans. And as you can imagine, 5 years it's not super flexible. It's not going to go as fast as technology moves in the world. But fortunately, one of the guiding principles of the strategy, the last strategy was from 2014 to 2019 and has been extended onto this year. One of the guiding principles is innovation and technology. So it's good that that is on the forefront. Unfortunately, what lacks is leadership and strategy for health and innovation in Mozambique. So largely things are kind of stagnating. A few bright spots, things like the technology for financing has improved, which means that budgets can be better spent. Databases for certain diseases, usually it tends to work in silos for like TB or HIV. Those things exist. Another problem that we have as a health system is that largely things have worked in a reactionary sense. So after independence, there was the Civil War, and after that, there was the HIV crisis that exists till today. So in terms of having long-term strategies and visions, that's something that we're slightly lacking in. However, one of the strategies in order to reform the healthcare system in Mozambique, a few of them is privatization and decentralization. And theoretically, those should be good for health tech to foster an environment for innovation. For decentralization, for example, unfortunately, decentralization has tended to mean responsibility to the provinces and the districts, but not so much decision-making, which also means that people looking to make solutions for the health system still need to go through the bureaucratic process of going through the central systems. And that's kind of another one of the major issues, is that in order to participate in innovation and technology, you need participation from the ministry, and it's a very big organ, and it's quite bureaucratic, and budgets are made in advance. There's not a lot of space in budgets for innovation to encourage people to bring solutions to the healthcare system, and on a local level too, district and provincial levels, they also do not have the possibility to look for their own solutions in their own communities, which is where I think we should be focusing in terms of how to foster innovation in the healthcare sector. There are a few bright spots. With COVID, things have been rapidly changing, and there's been a push to use technology to to get information out there. The government quickly assembled a website that posts data on COVID. Also in my work in FANSA, that is also one of the few consumer-based approaches to healthcare and health tech in Mozambique, because our users are the country. So we are able to get communication and health messages out to the population. And that's one of the examples in the country currently. Hopefully looking to change that.
We have a mic that's on that's kind of interrupting the background. Yara, thank you very much for that. Sorry, I was just trying to sort out the volume in the background. I hope you can all hear me still. I'm just going to move on to, and that was really interesting, because actually the number of points that you made there in terms of the role of government in facilitation, but also the looking for solutions in the communities. And I think that's something we'll probably end up touching on subsequently. I wanted to come on to Wale. You are a health tech, you run a health tech. I think it'd be quite interesting to hear about Wellvis, what it actually does, and a little bit about the COVID service as well, please. So over to you.
All right, thank you very much. So for Wellvis, we're an early stage digital health startup. And the idea behind that is to provide access to health advice, information, care support, because we understand that navigating the healthcare system, for example, in places like Nigeria, could be quite tough. You might need access to a particular specialist and you have no idea where to search. So the idea was to sort of create a platform where people can have conversations sort of peer-to-peer, however, still moderated by a health worker. So you're not just there telling people all sorts of lies and things. Mm-hmm. So we've created a platform where health workers can still moderate. They direct the chats, the conversations. And beyond that, we then created the telemedicine feature where you can then have direct conversations with health professionals, with doctors, with nurses, with dentists and the likes. And through that platform, you can then, book appointments at hospitals or at labs or at clinics, wherever you need. And beyond that, we were designing disease management tools, risk assessment tools in-house, just to help people navigate these things, because we understand that we're moving away from just core infections or infectious diseases in our community to non-infectious diseases like hypertension and diabetes. And we wanted tools that could help people manage those conditions, those diseases. And those were the things that we were designing right before COVID came around. However, when we realized that COVID was, a part of our community at that point, and that it was a clear and present danger to Nigeria and to Nigerians and Africa in general, we continued to disseminate information around COVID, around coronavirus, and how to protect ourselves and prevent infection. And what was the most interesting for us was when NCD started the work they were doing. They created a hotline where people could call. And we saw on social media people saying things like, oh, I tried out the call line just to see if it was working. And the idea behind that was we started to realize if these people are calling and trying to see if it was working, or they wanted just information around what is corona, what is COVID, that means they will be blocking access to people who actually needed to get in touch, people who had the disease. Then we figured the design of the tools that we were already creating in-house, we could just switch that over into something for corona. And that's why we created the COVID triage tool. And what we did was we got the case management for information from NCDC. We put that into clinically and epidemiologically relevant questions that could just give people an idea of where they were or what they were doing or the risk at which they could contract the disease. And that sort of shifted people into 3 different major risk categories. And for each category, they get information around what to do next, what to prevent. If they were low, they got numbers to call. And we did that we got multiple languages, local languages, we got English, just try to get as much people on the platform. And then beyond that, we were able to, for people who were high risk, we gave them the numbers of who to call. And then we started to look for state and federal partners where high risk people could actually be reached out to by the government, by the centers, by relevant public health authorities. But that was quite difficult. It was difficult to get in touch with the government. There was no, direct pathway to say, okay, we've created this thing and people have been using it. At the time, we started after a week of releasing the tool, over 300,000 people had used it across the continent, interestingly. But there was still no way to sort of get the people who were high risk across to the government. But through one of our partners, we were able to get in touch with the NCDC, who looked at the tool, who felt that it was something they could work with. They really liked the idea. They really wanted to work with us. But there was also a lot of bureaucracy. The conversation started in April. The tool didn't come out until maybe late May. So there was just all of those conversations that, you had to test. And that goes back to the old, just checking if everything was in order, if it was ethical, the data collection and storage. And those conversations were had. And at some point, we realized that what would be best for us to do was just to give the tool to NCDC rather than keep it on our server and try to make sure we reached all of those things. We understood what we were trying to build. We're not a pandemic tech company. We're a health tech company. And we knew that what we're trying to build was beyond Corona, or was beyond COVID. So what was best for us to do was to hand over to NCDC, which, as far as I'm concerned, is working pretty fine. They're contacting people through that platform now. And for us, it also serves as a funnel to our own business at the back, where people want to then eventually have a conversation with a doctor or to have telemedicine services. So yeah, basically that's what Wellvis is about, and that's what we've been able to do with the coronavirus or the COVID triage tool. And we've also eventually gone ahead to understand that, like you said earlier, access to smartphones or internet is still a bit sketchy around Nigeria. Then we've decided to work with MTN to build a USSD version of this tool, which is ready for deployment. We need to get, again, back to working with government. We need to get some licensing from the government so that we can put out information around Corona, using numbers, using all of these things. And that's taking some time. But that's where we are right now.
That's fantastic. I think certainly what you're talking about just sort of demonstrates the range of kind of collaboration and cooperation that you need to have with a variety of agencies in order to get something to work like that, which I know is something that Daniel's very sort of passionate about, so I'm sure he'll talk about that in a minute. Is a COVID service available across the continent now then?
Yes, it is. It is. For the one on our platform, so right now it's the sort of like double work, but just we're trying to protect ourselves. So we have one on our platform where you can go to at covid19.wellvis.org, and on that place you would find numbers to public health authorities in various African countries. You will find access to all of these things. The questions are relevant across the continent. We also update based on new findings around coronavirus. And then there's the second one, which is on the NCDC platform, which sits on the NCDC server. So that way they have access to all the information, and they contact the users based on the findings or the feedback from the users. The users putting their phone numbers, all of their details. What we try to do on our platform is we don't try to collect any identifying information, just to make sure that people are comfortable enough to use the platform, and whatever information they get, they can either act on that or move on. We know that we could be doing a lot more with that, but because of the lack of regulatory framework and all of those gray areas that most people in healthcare sit in health-tech sit in right now, we think it was best to sort of work that way. But what we've learned is that there's a need for these conversations to be had. There's a need for how to sort of navigate this area and have a black or white space, rather than we're just going to be here until something happens, or we're just going to stay in the middle until like Nigerians say, "Kasala boss," until something bad happens. But what we're trying to prevent is all of those things.
Yeah, no, that's fantastic. And actually, I was reading about the WHO. Speaking of inventions or innovations in technology that small companies around Africa have made that have had a bigger impact, like yours. I was reading about the WhatsApp bots that a South African company made, which the WHO has now adopted, partly to fight kind of fake information about the pandemic, but also for them to use for kind of just dispersing the accurate stuff. So it's great to hear about those kind of developments. So a lot of what you said there in terms of especially gray areas and regulation, etc., kind of takes us on to one of the biggies, which you also mentioned, which was about data, collection of data, storage of data and how it's used and people's privacy issues. And this is obviously one of the big kind of gray areas everywhere, even in, we've seen in European countries, track and trace devices that have been put out there in public and withdrawn. In Norway has done that. Germany has recently switched providers or switched devices, always with the whole kind of data protection issue causing problems. I'm not sure who's cracked it, apart from people who don't have a data protection environment, shall we say. So Ridwan, you're a resident data protection expert. Can you give us an overview of the challenges that are facing the health tech sector from a data protection and privacy perspective? And also perhaps for those who are on this call right now, who are health tech companies or prospective ones, what are some of the issues that, overview of the issues that they absolutely need to be aware of?
All right, thank you. Yeah, so of course, we're in a special time that requires special measure. Mm-hmm. And of course, that also means the fact that we're not going to do things the normal way. But in as much as we have a public health crisis on our hands, we also need to as well try to balance that pretty much with the human right of people. Because of course, we can't do anything with complete disregard to human rights. So especially when we speak to the privacy and data protection implication of so many of things that have been done currently. So of course, looking at privacy as a right itself, it also spills into some other rights, which means if there's a violation of your privacy rights, it will affect your freedom of association, it will affect your freedom of expression, it will affect even as much as maybe even possibly freedom of even your movements. So looking at it also around the innovations that have been developed around this period. So whether you're talking about the contact tracing, whether you're talking about self-tracking, self-assessment, or whether you're talking about even different measures that have been introduced by governments. So ICNL have been able to track a number of measures that have been developed across the continent. And I'm going to reel out numbers now. So we've got like 45 African countries that have introduced different kind of legislations across the continent, specifically targeting combating the virus. So also we've got, of those 45 countries, we've got like 37 who have actually introduced measures that could actually impact on human rights. Then outside that, we've got like 18 who have actually introduced measures that are close to state of emergency. And what this simply means is pretty much your rights are actually just swept away. Pretty much what we've seen in Hungary, where the Prime Minister announced he's actually waiving the application of the GDPR in the country. So literally suspending your right to privacy, your right to data protection rather. So also of those 18 countries who have introduced different measures that are close to state of emergency or different emergency measures, just 7 of them have data protection laws. So of those who have data protection laws, not even all of them have data protection authorities. So if you look at the African landscape, for example, Africa is divided between countries who've got data protection laws. And that we've got like about 20 African countries who have like the different data protection laws right now. Of that, we've got so many other number of countries who have also got different measures in terms of bills. So Zimbabwe is probably one of the most recent who actually introduced a data protection bill recently that is actually fusing with its own cybersecurity measure. Then of that, as a last count, we have about 14 or 15 of those countries who have a data protection authority. So which means of the 28 countries with data protection laws, some has data protection, have decided to set up their data protection authorities, some have not yet. So so when you look at it, I've got like countries with no data protection laws or where you won't find anything close to privacy at all. So basically, there's no such protection. So all this begins to make sense when you begin to look at different measures that have been introduced by different governments. So for example, Botswana is a country who has actually introduced a contract tracing app called BeSafe, and which is also made mandatory for everyone to have. So even if you don't have a smartphone, for example, it means when you go into a premise, they have to take down your national identity number just to be able to identify you, your contact information and all of that. So the issue of the whole idea of contract tracing is first, it should be voluntary. Why do you need to force it down on people? So also you want to also look at if in this app itself, it is actually privacy friendly. So part of what we did as an organization in Nigeria is there are a number of states who have actually introduced self-triaging or self-assessment apps. So we did an analysis of 2 states. We analyzed their apps, dissected it, and weigh it against data protection standards. And what we found is actually quite stark. In one example, we actually found a state government hosting the website on a third-party app, which itself has its own risk. And we also found a state government who's actually hosting a self-assessment app on a site that is actually doesn't even have an SSL, which means your protocol is pretty much unsecured and everything just goes visible to a third party who probably wants to see all of that. So as a continent, of course, we need to be more mindful of all of these things. And the interesting part also is some things have been done. At least about 8 African countries introduced different guidelines, measures, statements around implication of data protection and combating the virus. So one thing we need to bear in mind also as innovators in the sector is also that when you're playing in the sector, for example, you understand that the kind of data that you hold is not just the typical kind of personal data. So depending on what the law calls it, it could either be sensitive personal data or special categories of data, which means they require a distinct level of protection away from the typical data you probably just run into. And that's because health data is something that says one common truth about you as a person, and it doesn't change. So you've got pneumonia at one stage in your life, you've got it, you can't manipulate it. So, and if people's health data become something that becomes something of public, or maybe there is a violation of their rights, for example, it's really terrible because it could have really direct impact on them, social impact on them. So as an example, part of what we did last year also was looking at, so there was an HIV survey that was done in Nigeria, for example, a couple of years ago. So at some point, we actually found out the result of the survey of the HIV test was actually available on the dark web. So what that meant also was, according to the ministry that was responsible, the government agency that was responsible, they said the information were anonymized. But pretty much what we know now is that anonymization, it's not really a foolproof strategy to really protect people, because if we are able to aggregate this data or combine it with some other data, we could be able to identify this to be distinctive. So away from saying the data was anonymized, part of what we're able to discern also the centers where these tests were conducted, you're able to also discern the results of these tests. And when things like this become available, and when either regulators or private players in the industry ignore privacy and data protection, it could really spill a big catastrophe for individuals who are actually involved. So for us, pretty much as we have a public health crisis, we need to do that. We need to manage it with full cognizance and full consciousness of privacy and data protection. And of course, it doesn't matter whether the country where you are right now, where you're playing as a full data protection law, if you're actually seeking that global relevance, you're seeking that global competitive advantage, we always recommend you put in place best industry practices, safe measures to actually protect people, which you're trying to provide services to. So I think I'll just stop at that and maybe pretty much later touch on some other things.
Thanks very much, Ridwan. Can I just ask you, you mentioned the sort of two Nigerian states that you had a proper look at their track and trace tools that had been kind of rolled out to the public. So have you revealed your findings to the state authorities, and what have their responses been?
We've not done that yet to the state governments. Well, pretty much we just put out the findings, the result of the findings, what we found, and we put it out there. But that's something we intend to do too, to share it with the relevant state authorities and of course the main regulator also of data protection in the country.
Yeah.
So it's something we intend to do. We have the findings out there currently.
Okay, great. Really useful to hear what their responses and actually how they engage with you and others to kind of address those issues. Well, let's turn now to Daniel. So we've talked about data protection and privacy issues, and I know that's one of your areas of interest as well. But if you look more broadly at the legislative and regulatory environment on the continent, how robust are they in terms of addressing some of the issues that will arise from health tech activities, particularly for COVID? So this is just looking beyond data protection and privacy, but just a kind of wider enabling or in fact sort of limiting environments.
All right. Yeah. Hi, everyone. So as you all probably know, the right to health is a foundational right in any democracy. And traditionally, health itself is a heavily regulated sector. And what Wale has touched on, waiting until something goes wrong, is just not an acceptable regulatory approach when it comes to health, as the cost can potentially be human lives. So we do have a number of issues on the continent when it comes to health tech. And they are actually stemming more from external factors like a limited number of manufacturing facilities for medicines and tech equipment, which requires imports and opens the door for further regulatory concerns such as standards and quality control. And what Yara touched on, that there are indeed many policies on the continent, as in Mozambique, the 5-year health tech policy. Many countries have the same thing, but these policies are not very entrenched, and further development is much needed at the continental level. So as we get to the continent at large, as Wellvis, the platform is applicable across the continent, so is COVID. And the result is that we need a more harmonized approach. The existing regulatory structure is just not sufficient, especially if countries end up developing their programs in isolation. So I want to turn to one African country that has actually seen significant growth in the health tech and ICT at large, and that's Rwanda. So following their genocide, Rwanda adopted the Vision 2020 and decided to push how they were going to build Rwanda as a mid-tier ICT-based service industry or service country and economy. And they pushed that with a multi-stakeholder government-led approach with partnerships between ministries and ICT startups. And that's been very, very successful. On the e-health side, they did establish a technical working group. And this is led by the Ministry of Health and the Department of General Planning, Health Financing and Information Systems. This department is particularly important when it comes to health tech, as they are mandated to coordinate a dialogue between private and public sector and to encourage private sector involvement. They also have the National Accreditation Steering Committee, which oversees the accreditation and of innovations and advancements while engaging multiple stakeholders. So this touches again back on the problem of providing standards and regulatory approval of innovations themselves, especially when they're imported from overseas. During the pandemic, Rwanda has really come to the front. They adopted the Emergency Response Project for COVID-19, and it was funded and approved by the World Bank. Their response project focuses on harnessing digital solutions and digital analytical tools that help improve, contain management of the COVID-19 response. They've developed digital maps that allow the visualization of the spread of the disease in real time, mobile applications for sending health messages, and telemedicine capability to allow for suspected cases to be assessed without the need for physical movements by patients. That's where Rwanda has really led the continent. South Africa has tried. We have the Ministerial Advisory Committee on e-health, which was established in 2016. And we do have a national digital health strategy, which was adopted last year. And it's another one of the 5-year strategies from 2019 to 2024. Some of the interventions that the strategy tries to address are the development of leadership capacity for digital health, to undertake multi-stakeholder engagement for successful implementation, to develop sustainable interventions, and to formulate a national legislative policy and regulatory framework. The strategy does state that stakeholder engagement is essential at all levels and is a priority. And the strategy also sets out our current existing legislation that is impacting on health tech. The Electronic Communications and Transactions Act addresses privacy and confidentiality of communications. The Electronic Communications Act provides the basis of connectivity. The Protection of Personal Information Act, which just got approved by the executive yesterday and is commencing on the 1st of July. Well, some of the provisions are commencing on the 1st of July, the next a year later. That addresses privacy and confidentiality of health records, and the National Archives of South Africa Act defines security protocols and retention requirements. So we can see that confidentiality, data protection, personal information are key requirements for health tech and are defended in South Africa. But what about all the other requirements? And these other aspects, such as standards for medications and services, financing for private startups, and skills development, are lacking. They are identified as priority areas in the strategy, but we haven't seen effective implementation yet. So during COVID, telemedicine did come to the forefront with the Health Professions Council for South Africa releasing guidelines on telehealth. And they have permitted telehealth applications in circumstances where there is already an existing practitioner-patient relationship, with the exception of telepsychology and telepsychiatry. So we have seen growth on the continent and in Rwanda and South Africa, the two case study countries. But regulation in Africa tends to be master and control approach, where we need a more collaborative approach. The strategies that have come out have called for collaborative approaches, but we have not seen that in practice yet.
Thank you, Daniel. Yeah, I think, quite often you find that regulation in all sectors really tends to always run behind innovation. There's always a catch-up game where, in fact, if you had an enabling environment set up from the get-go, then you encourage people to come in and experiment and find ways of doing things when they're already encouraged, rather than sort of running scared. That's kind of a story that we hear all the time. So Melissa, I'm going to ask you, given the rave reviews you just had for Rwanda's response and working for Zipline. Zipline has always been seen by many as quite an advanced sort of health tech, if you like, delivering, services such as blood, etc., by drone across the country. Can you tell us a little bit how Zipline has navigated the regulatory issues? Because despite having a very enabling environment, I'm sure there have been some issues that have arisen, and how has Zipline managed them, particularly having two, at least on the face of it, two regulators, a healthcare regulator and an aviation regulator?
Well, thank you very much, and thank you for having me. Yeah, so thank you, Daniel, for the introduction about Rwanda and how it works, actually. Hello, can you hear me?
Yeah, we can hear you. I think your camera is a bit frozen, but we can hear you.
Okay, perfect. Okay, perfect. So yeah, so Zipline, a success story here in Rwanda. Of course, it was definitely a journey and something that we've learned so much in terms of like us as a private company and also the government. So yes, we do deal with the main regulators will be the Ministry of Health and anything about the aviation industry. But we look at we do, as Daniel mentioned, we do talk to different governmental institutions, and Zipline's impact is seen in different angles depending on with what institution we're working with. Like, for example, like in terms of like the Ministry of Innovation and Technology. So basically, like, as they mentioned, Daniel mentioned it before, is that Rwanda positioned itself as a country that is advanced in terms of technology and technology that are used for good, right? So having that idea of using technology to try to fight some of the challenges that are happening here in Rwanda and also everywhere in the continent, basically. So having a technology or like a company that uses technology is definitely one of the things that they are looking into and are welcoming. So we also have the Rwanda Development Board. So that institution is basically in charge of like finding ways of investing in Rwanda. So having companies like Zipline, that is an American-based company, coming to Rwanda and investing here in Rwanda. So now, yes, the company is American, but now the whole company here in Rwanda is not only managed, but also operated by Rwandans at this point. And having basically that type of like private sector and companies coming here in Rwanda and basically like do their proof of concept. So Zipline was very attracted to Rwanda to kind of have that idea of proving their concept in a country. And that's how we were able to actually have Rwanda as the first country that has a national scale drone delivery. So of course our contract is also signed with the Ministry of Health, and the way we see our impact with the Ministry of Health is basically the fact that we support the Ministry of Health, and our way of supporting the Ministry of Health is basically in the supply chain of blood products and medical products, mostly in rural areas. So our contract basically is to kind of like bring easy and very fast access of blood products and medical products in rural areas. So in this situation, what happens is that a small health center, no matter where the location is in the rural areas, can basically order any of the product that we have. So basically we have everything. The way the supply chain works here with Zipline is we centralize all those products in our distribution centers, and then facility can pick up a phone and call us or even text us in order to make their order. So it usually takes 7 minutes to order, pack everything, and then send the drone to deliver the product that was ordered to the health facility that has contacted us. And depending on the location of that health facility, the package is actually delivered between 15 to 45 minutes. So for example, a place that usually takes 4 to 5 hours driving, with the drone, we're actually able to deliver it in 45 minutes. So in terms of like, let's say, when someone's life is underlined, that is a very big impact on the situation in order to save someone. So this is what basically is our impact here in Rwanda, is basically to have like a fast and easy access of those medical product, blood products, and even other rare products that are in the supply chain. And also, second thing is also to make sure that those products are not wasted. So for example, like those facilities, knowing that they can have an easy access to those products, they don't need to overstock themselves and then waste the product because they know that they might not have access to them in case they need them. So with our service, basically what happens is that they have a minimum supply per day, and we make sure that in case they make an order, we send it as soon as possible, and we supply them by the end of the day. So this is what basically the type of support that we bring to the Ministry of Health. And in terms of aviation, so of course, as I mentioned from the beginning, like Zipline was so welcomed by the government itself because not only is it because of their policy and strategy of becoming a hub that uses technology, and second thing is also that the technology that we were bringing was actually bringing a solution to the challenges that the country has. So of course, we use drone to do the deliveries, and it was introduced to Rwanda back in 2016, where we not only did not have any drone regulation, as we know, there's no like harmonization when it comes to drone regulation. And second thing, drone were not seen as a good thing. It was very taboo and very sensitive in terms of like security and national security mostly. So again, in terms of regulation, it was a journey, and we had to learn from each other. Like for example, between 2016 and 2020, a lot of things have changed in terms of like regulation in this situation. So for example, the best example would be the way we communicate with our air traffic controllers in the airspace, in terms of like our airspace integration. So not only did we have to Rwanda had to create their drone regulation before we started operating in Rwanda back in 2016, which was among the first countries that actually had drone regulation. And second thing, we had to learn from each other and try to find a way to make it work. For example, like if you look at how we started in terms of like of our aircraft, the technology has changed due to the things that we learn along our journey. Second thing is also like how to make sure that regulators also feel confident enough to trust our operation to be safe into their airspace. So like, for example, the best example would be how the drone regulation is basically like segregating the airspace between manned aircraft and unmanned aircraft, basically drones, and how each one of them has like a ceiling and altitude where they are supposed to be flying at. So another example would definitely be also on our on the operator side. Some of the learnings that we had was how it's complicated and not easy to monitor the drones, because there's no system to monitor drones the way planes are monitored in the airspace. So we actually had to like build up tools. Like we actually have like a user interface where the air traffic controllers at towers are able to monitor our aircraft and our routes. So we also create our drones are fixed wings, but we create a flight path in the airspace. And of course, we need to look at the different challenges of the terrain. We look at anything that looks about terrains. We look at ground obstacles that may be on the ground, like cell towers, because we fly at lower altitude compared to manned aircraft. So we create those flight paths, but at the end of the day, the regulators are supposed to not only approve those flight paths, and we need to also make sure that we use always those paths that have been approved by our regulators. So like it was definitely like a learning that we had on both sides, and there are so many different aspects. It would take me an hour to talk about everything that we exchange and the different conversation and relationship that we've had with our regulators. So of course, like we see the success in Rwanda by having a drone regulation put in place in 2016 and having drone regulation in 2019 that are actually performance-based. So for example, if a drone operator comes to Rwanda, yes, the regulation is there, but as long as you can explain your challenges as an operator, there's a way to make it work. Like that's why you definitely now see different drone operators into the country doing different things, because drones are used for different reasons and purposes. So that type of regulation being performance-based is actually able to attract a lot of people. And of course, that's how you see that we actually have nowadays a lot of drone challenges here in the country as well. And basically like the whole ecosystem is attracting drone operators and drone people that are enjoying drone technology as a whole. So of course, COVID also like taught us a lot of things as well as a company, because at the end of the day, we are part of the healthcare system, no matter where we operate in. So as you mentioned before, we also now operate in Ghana. So whatever we learned in Rwanda in 3 years was we learned so much in Rwanda that we're actually able to scale in Ghana very fast, where we actually have 4 distribution centers and all of them were opened like in less than a year. So and of course, again, depending on what, as I mentioned, we support the health system in the countries that we operate in, and depending on what type of support we can bring in that country, that's how our operations were able to change and help during this pandemic. Like for example, here in Rwanda, we were able to actually bring cancer medicine closer to cancer patients that had to go further to a cancer facility that is quite far. So we were able to actually bring the medication closer to their homes by delivering it to a hospital that is closer to them. Of course, there is a lot of coordination with the Ministry of Health and making sure that we can support them in that situation. So basically our work is to help and find ways of integrating our services into the health system. We also did different work in Ghana, where we were actually delivering different PPE using drones as well. And also, not only was it faster in rural areas, but also it was also reducing that human contacts as much as possible during this pandemic. And we actually also had a sample delivery, test sample delivery in Accra, which was actually the first time that we did it. We did fly in a city, so it was a big win for the company as well, and something that we learned a lot as well. And also, like us, we also started flying in the US again to deliver PPE as part of the support that we are providing during this pandemic. Yeah.
Thank you. That's great. Thanks, Melissa. It's very inspiring to hear all that. I think sometimes the idea of the invention of a company that does that, particularly the blood supply, that's the thing that has always made me feel slightly anxious about Zipline, is I'm just imagining the lawsuits that could ensue from, you know, the drone flew a bit too high and the blood was too hot or too cold and it was transplanted to somebody who then later, you know, so I'm sure that your health sector regulators are always on top of that and certainly co-creating the regulation onto issues like that, where the Zipline learns from the regulators what the issues are and vice versa is certainly the way forward. I'm just going to ask Cynthia now to look again, we're still now looking at the public policy side of things, not just sort of the regulators, but on the government side, if you like, and beyond, both national government, regional government, but also overseas donor agendas. Can you tell us a little bit, Cynthia, about what the other grey areas exist that are yet to be addressed by policymakers? And that's overall in the health sector. So in terms of education and skills transfer, understanding of what technology actually is, etc. What are your thoughts on that?
Thanks, Nankunda. I think some of them have already been touched on in the presentations made by the panelists. Mm-hmm. When we look at regulation, enabling environments, I think Daniel touched on a lot of the areas. Mm-hmm. But if I take it section by section, when we look at education of health professionals, currently, if we look even on the continent, I can count maybe like 3 or 4 dedicated programs that look at health tech, informatics, the broad and also specific training of health professionals or even tech professionals in delivering health services. The time it takes to bring a curricula out in the current construct of a university in Africa is anywhere from 3 to 10 years. An attempt that I made when I was in Botswana supporting the Faculty of Health Sciences at the University of Botswana, it took us 4 years to even get one mod. That was even just one module, not alone, not even a program. So for me, this is a big challenge. Although in the last few years, of course, there have been other agencies that have come up. And Rwanda is, of course, a great example of how they've been able to bring in external support to fill gaps that they needed resolved. When we look at skills transfer, and I think Yara is also going to touch on this, one of the biggest problems that I see is emerging, if it hasn't been looked at, is the fact that a lot of the big national technology products or projects are donor-led, donor-sponsored, donor-resourced. And as soon as the money dries out, that is when that project would cease to exist. I think you can even see, for those of you who follow in the open source space, where OpenLMIS, which is actually a supply chain tool, is facing a bit of a challenge, or not to be dramatic, but crisis, where they've now reached a head where they can no longer continue the way they are, and are looking to private sector or some agency to take up the work that they've done. And assuming nobody takes it up, that's a problem. The whole system, ecosystem that's been built for X amount of years in 8 or 10 countries will just disappear. So this is a big problem that I think needs to be really addressed and looked at by donors, that it's not only the delivery of the technology or the collaboration with the government to get the technology out there, but also who is supposed to support it? How will it be supported? Is it a partnership with academia to develop a unit? Like, I think there's one that does it very well, which is DHIS2, which has incorporated some of its support aspects in the University of Oslo. Such models, or even with private sector, how do you engage with private sector to take a more commercial approach to supporting these technologies, because their impact is nation or even regional for some of them. So this is something that I think is very, very, is a ticking time bomb, I'd like to say. And then when you also look to skills transfer, it's really based on users, not necessarily the constructs of these applications. How are they put together? Why are they put together in that way? Why is it, how has it been contextualized to the context of where it's being implemented? That's another area and that's a whole other conversation together. And then when we come to regulation, I think Rwanda is the beacon. I wish all 54 states on this continent could be like that. But to Wellvis's point, even getting access to the right person to even put your proposal or your idea in front of is very difficult in any government setting on the continent. I was laughing at when Daniel was talking about the e-health regulation of South Africa, and prior to that policy coming out, all the challenges they were having with telemedicine services, and how and even you could even tell from the tone of the new Telemedicine Act that they still demand that you must have a personal contact at some point be prior to that teleconsultation, which in practicality is close to impossible. So really, there are still some areas which need to be looked into, but specifically, regulators are interested in a couple of aspects. Some of them have already been covered, which is your data storage, protection, privacy, but then also quality of care. How are these technologies meeting those quality levels that are being stated or being asked for? And how do we ensure that this technology is going to be there for the test of time and not necessarily just for a few years and it dies out or the company goes bust or whatever? These are some practical areas that are important. And then on top of all of this, you've got guidelines. Now, guidelines are written by seasoned people who understand how the services are provided, but also understand from the technology standpoint how it should or could operate. And quite frankly, it's very difficult to tell if there are people within these regulating bodies who have that expertise. What has been happening is a copy and paste. They've been to a conference, they heard Malaysia talking about it, and they went and said, my friend, just give me a copy. Or they'll go to Singapore, or they'll go to, whereas, and even if I speak specifically to telemedicine law, the oldest ones are France, which was 1997 when they first started it out and had a proper structure. And then you have the US, which has been more robust at it. And from what Daniel is saying, perhaps South Africa has come out with something a bit clearer, but it's still in the practicality of operations is still very challenging. And so these, even when it comes to the actual transaction of the service, I think I appreciate what the team from Rwanda had been doing, like working together, experimenting, having these opportunities to come together and try different use cases. When we talk about delivery of even point of care, what constitutes a medical service? You know, when you are running it on a digital platform is very different from when you run it face to face. And so what are the guidelines, or what guidelines would you apply, or what criteria would you apply to the provision of service that in the eyes of the regulator, they will agree that yes, a service was provided. And yes, as you look forward, a health insurer can provide it. In South Africa, I don't know if it has changed, but prior to this new policy coming out, the health insurers made it very clear that anybody who did a telemedicine service, if any adverse event were to occur, they are not liable. They wouldn't pay for it. In Kenya, where they had been trying, and over the last couple of weeks, they've come up with some guidelines or some framework under which these services could run. It's still very unclear where the point of liability is. So, and even insurers are still asking that question. So there's going to be, as a tech provider or somebody looking to provide a business or a health service, there will still need to be a lot of heavy lifting on the part of the provider to bring in all these pieces to drive that conversation and bring all the pieces together. I don't think we have the luxury of Rwanda, where you can call, maybe Botswana is a close second, but where you could call the regulator for telecoms, call the ministry, call the, and put them all in one room, and, you can get things sorted out. But in many other African countries, it's not that straightforward. So I think there still needs to be a lot of work. And my hope is that in starting this dialogue on this platform and many platforms, we have a call to action that encourages or advocates for these conversations to start happening at our community level, not waiting for somebody to come from outside and say, do it like this. I think this is really the key areas that we need to look at.
Thank you, Cynthia. You make a compelling case. I don't see that there's an alternative but to kind of keep going, given the momentum that we have, even if we're a small group at the moment, but we've got a number of people who are with us watching and listening. So Yara, can you pick up a little bit on that point about the kind of donor community and a lot of the activity? Because even now already in sort of COVID, where a lot of people have sort of retrenched and looked at their own individual circumstances, there's still growing pressure, certainly from the WHO and other multilaterals, to say we need to commit funds and policy directions and aid giving to help the developing countries and develop sort of more robust kind of responses, which would include health tech. So what's your take on that and your experience?
Right. So the international donor community plays a huge part in health across the continent. In Mozambique in particular, as much as 10 to 15 years ago, about 50% of the health budget was from donors, from external sources. Recently, that's reduced to about 14% in 2018. But the point is, they have a huge amount of resources and influence when it comes to the health sector. And in particular, the health sector itself tends to focus on paying for things like salaries and stuff. So a lot of innovation, a lot of the extra projects come from outside sources. It used to be through like a swap, but now it's mostly based like on a project basis. And what this means is for a lot of health tech solutions is that, or products, is that they're coming from abroad, and they're coming from different contexts, from people who maybe don't even know much of the local context, and may not be fit for purpose. As we discussed, sometimes it's copy paste from another country, but also even just as much as like framing the situation, a lot of local problems need to be framed in international ways for that to be palatable for donors. And what happens is there tends to be distance between the actual beneficiaries and the projects and the donors. Another thing is that this is not super flexible. And when a country, for example, like Mozambique, doesn't have strong leadership and strategy when it comes to these, what can tend to happen is that these projects, these international projects, can become really fragmented. If we're talking health tech, I've seen personal situations where one department can have 4 different softwares for one thing, and they're not compatible with one another, and everyone there has to learn it. And in theory, the ministry owns it, but in practice, it's just been like placed upon them. Even the whole process of writing a proposal, it can take from when you put the call for the proposal to when the project starts, it can take 2 or 3 years. And if you imagine in like COVID times, that's just not really, it's not tenable, and it's not really a good environment to foster innovation for like, in particular, locals who know the context and who have the skills to want to build solutions. It's not a very attractive prospect for them to be like, okay, well, I'll just wait for a call for proposal, and then I'll frame my solution in terms of their needs, and then I'll, build my whole project about monitoring and evaluation for their needs and all of that kind of stuff. And that's even if you have the privilege and the social networks to even be in contact with those kinds of solutions, and to know where to find a proposal and all of those kinds of things. And then I think, as Cynthia also touched upon, a lot of what happens is ownership is not, there's not a lot of ownership from the country itself. There are a lot of problems with, for example, sustainability. Are locals being taught how to use these things? Is it really, again, fit for purpose? Are we putting a lot of technology that isn't appropriate into situations, and then in 6 months we'll see, wow, like nothing's working, but we've put all this money into it. We're not flexible. The government doesn't have enough of a strategy to say, like, this is how we fix this, this is how we harmonize and unify this. And again, it's just left for the donors to try to fix. And again, a lot of times they bring their own, I think another really major point, they bring their own softwares and those kinds of things. So like, in terms of like the profit motive, there really is none of that for people in Mozambique. They're bringing their projects with a lot of money, but the money then goes back to their own country. There's a lot of reasons why, from a national perspective, there's less benefit that there should be. And then of course, on top of sustainability, there's volatility, because it's really hard to plan for these things. Like I said, the proportion of external funding has decreased quite a lot in the past decade. With something like COVID, where a lot of the countries that we consider leaders kind of stepped back and maybe didn't have their own strategies, and also weren't necessarily there to provide the support countries like Mozambique might expect. And I think in the future, we maybe have to think that these kinds of things are going to happen more often. And this is just another reason why we need to have more investment and more of a fostering environment in our communities and in our countries themselves. We need to have collaboration regionally. We need to have multi-sectoral collaboration, so that frameworks exist inside our own countries, and that innovators have access to that information and are readily available to bring their ideas to fruition in a simple and effective way.
That's great. Thanks, Yara. Well, as the English say, beggars can't be choosers. So, if your only source of income, and certainly governments have prioritized certain things and left other things for the donor community to come in, then the chances are the donor communities will have their own objectives. I read a report not so long ago, actually, and it was talking about innovation in tech in the legal sector, specifically in emerging markets, but looking specifically at Africa. And they found that most of the tech innovation was in areas that had been highlighted by the donors as the gap that needed the most attention, which is access to justice, which is fair enough and is probably accurate. But because there wasn't a view to commercialize the innovation, and you got a grant to create your innovation. If you got a grant of $50,000 a year, you could live on that for a year very well. But a lot of the inventions were not then subsequently taken to market or sold to government or promoted. It just became this sort of ongoing system where people create a new gadget, new kit, and then apply for another fund that's come up, from different governments, and then you kind of serially make a lovely little tech solution, but you're not really motivated to scale it, sell it, give it to anybody else, because there isn't any real need for it, because the donors will just continue to fund it. So I can see that sort of moral hazard issue that arises when you have that kind of system. Our next webinar actually will be covering some of these topics quite interestingly, because we have a health tech investor who's going to be a speaker on it and who is a Kenyan. So it would be very interesting to hear what his perspectives will be on investing in health tech from an African perspective. We also will have some academics from universities, one from the University of Wale in Ethiopia who's she runs a sort of AI and health tech unit at the University of Wale. So that would be really interesting to hear from that perspective. But just to sort of move on from this, so Wale and Melissa, Wale, you've heard a lot of the views from everybody else on what the gaps are, which you know well yourself, obviously, because you're operating in this environment and trying to kind of get your Wellvis scaled up and doing what it should do. What that hasn't been mentioned yet, would you say really, or actually probably better, what would be the top 3 things that you would say a health tech needs from government and from the regulators? Wale, I'll ask you first.
All right. So if I'm using the Wellvis perspective and from our own end, I'll use an example. So we were talking to a state about deploying a particular solution and making it, broader and do something for them. And the conversation sort of led to financing the project. And straight, out of it like that, I was told, if we can find a funder, then the project is a go. So I'm surprised that I'm trying to sell you something and I have to go find someone who's going to buy it for you. It became a bit confusing for me. But it wasn't so confusing for me as it was for my partners, because I've done a bit of work in development, and it's very clear. Something that we've seen and we've heard, but those are things that still exist. And I was kind of happy leaving development, thinking I wouldn't have to face things like this, and moving to tech, which is a lot more. We come in, you disrupt, and you move. Now I'm like, oh, you're about to disrupt. All right, before you disrupt, go get funding to come disrupt. Like, all right, there's a lot of work I'm doing here. So these are some of the things that are a problem for us. Funding really is it. But I think from the perspective of, venture capitalists and PEs and the likes, you can sort of navigate that area when it comes to small projects between you and another business. But when it talks to government level, you need government buy-in. And a lot of times we still understand that there's a lot of, corruption. Africa sometimes is a country, and we still understand some of these issues that exist. And then again, secondly, would be the legal and the regulatory frameworks. They really don't exist, at least in my part of the world. And although we're building our own platform to sort of have data regulations and protection things working, there's NDPR in Nigeria, which exists and sort of caters for all of these things. But on my platform, we're working with all the set out laws, but implementation has been funny. And a lot of other startups or competitors are just, you get them, you find them in the market who are willing to do a lot worse than you're willing to do. And that sort of creates some sort of, the investment you're making into your own platform. They don't have to make they don't have to make those investments because, one, maybe they're not even planning to stay long. Maybe they just want to, again, get a grant somewhere and prove a concept. And they get their grants, they move. While you're trying to build a business, you realize that all the guys you're competing with are grantopreneurs who have moved funds and you're unable to sort of make that next leap for your business. So some sort of framework to, if you have to meet particular standards before you get into the market, that sort of creates a barrier to people who are not interested in the long haul. So I think something like that will be very helpful, especially for at this time. Although we're not primarily a telemedicine company, we're a telehealth and digital health company, which we produce a lot of, we offer a lot of other services, but that is our core solution at this point in time. So that affects our own bottom line as a company as well, because we're making all this investments into our company. We're making investments on the servers and type of service or the all the other things that we do. But some other guys are able to just go through that and probably give us a run for our money. And then finally, it would be important to have a level of stakeholder engagement. So when you're talking about stakeholders in this space, we're probably looking at the operators to the regulators, to the funders, to the users. The truth is, it's going to be a huge number of people to sort of get together, and knowing how things work, knowing how people live for per diems in areas like this, it's going to be very difficult, which then goes back to what Yara was saying. He has to be funded by some partner. And the partner, until that partner wants to fund that sort of stakeholder engagement before that happens, because I don't think the ministry is going to get telcos or going to get the regulatory body for healthcare or get medical association bodies into a room and have those conversations. All those guys are coming and they're expecting their per diems. The ministry is not going to pay that. And we've had conversations with stakeholders where you're like, oh, we're going to have to try to get a meeting. Like, who's funding the meeting? Oh no, it's just something. It's like 2 hours. So is there transport? No, it's their per diems. Who's serving lunch? Who's catering? And you're like, we're trying to get a stakeholder engagement happen. This is not where we're trying to get to. And you know that those conversations won't happen until someone takes that up. So I don't know who's going to have to take that up without an ulterior motive, but those kind of conversations have to continue. And we know that nobody takes all of these conversations without them. And now that we're in this era of data is king, people that take this up might not seem like they want anything else, but they will just, oh, by the way, can we get access to your backend so we can get the data? And I'm like, oh, that's not a lot. That's not a lot for this $1 million that you're putting into this project. But you have to have someone who can protect your own interest as a company, who can protect your interest as a country. And unfortunately, what we have right now, I don't think they're excited about it. I don't think they know the consequences of not doing that. And I don't think for them, it's something that sort of matters. So as a company and as a Nigerian, those are some of the things that I'm most concerned about when it comes to implementing healthcare solutions or health tech solutions. And unfortunately, we just have to keep having these conversations until, I don't know, some revolution of some sort that happens, but I don't see that happening immediately. So it has to be small scale conversations like this that then hopefully cascade into something slightly bigger and then something slightly bigger. And if you look at the telemedicine space, for example, in Nigeria, there are people who have come before we came and failed woefully, but it sort of created a path for us to know, okay, these are the things that they did that failed. But that's from a startup or a business perspective. But from a political or a policy framework perspective, it's still the same old thing that happens. Distribution is still strongly not available. And now we are looking at financial institutions, we're looking at insurance companies as our main level of distributions, when the national insurance company is by far the easiest. If you can agree with them and they can come to terms with your solution and agree with that, you're automatically provided access to over 10 million people. And by that, even if I can capture 5%, 10%, 20% of that, then I know for a business, this is something that can survive. This is something that can scale. This is something that can go public and, can continue to be sustainable, rather than I have to deal with a bank who's like my biggest customer. And the day the bank says, we're no longer interested in this, then my company almost loses 80%, 90% of its revenue. And then I'm, back on my bum and I'm looking for the next. But with the government, I think just establishing this sort of stakeholder engagement or a technical working group that looks at financing, that looks at distribution of solutions, that looks at what the solutions offer and the quality of care that they offer at the point of care and all of those things, is probably the most important thing. If those are available, funding and operationalizing and implementing will be existent. Because I think there are people who would want to act or participate in the space, but are also quite worried about government policies. We've seen that happen in Nigeria, for example, with the bike hailing space, where tomorrow someone can say, for example, if the person in the Ministry of Health in Nigeria decides to go to South Africa and pick up their laws and say there has to be a physical contact before telemed, then I've never seen half of the people that come on my platform. I don't even know where to live. Interestingly, we've started to have people, although we have an open platform, we've started to have people from outside Nigeria contact us on that open platform just to seek second opinion, seek direction, seek, okay, this is what is happening. Which of these specialists do I need to speak to? Those are not exactly healthcare questions, but they are questions that happen within the health space. So if I need to see that kind of person before I can provide some sort of guidance, then that defeats the whole purpose of telling in all of this conversation.
Thanks, Wale. I do have one other question actually I want to ask you. As a doctor yourself, you are a regulated person, and you have to abide by a code of ethics. I wonder how many, if you know just offhand, A, does that assist you in your development of your service? One, B, are there many doctors who are creating tech solutions? It's always an issue in the legal profession. There's also always this conversation of lawyers, becoming coders or whatever it is. To what extent is that the case in the medical side of things?
It is the same thing, but it's not strongly adhered to. It obviously, for a lot of companies, what they do really is they find someone within the healthcare space to be on their team, particularly when raising funds. So is there a doctor on your team? Is there a technical partner on your team? So it makes a lot of sense. For us as well, interestingly, my partner and I, we're both doctors, but we have I don't personally have an idea of what a line of code looks like. So it was important that we got a technical partner who could at least code out the things and make it look in a particular way. We got a business person on our team, and we've been able to do that. But primarily, the core team is technical and operational. So they're doctors and they're tech people, and there's a business person. And we think, if I'm not being biased, we think that's a perfect combination of things. But there are platforms where one of the biggest telemedicine platforms in Nigeria now, on their founding team, I don't know about their management team, but on their founding team, there's no health professional on it. But they've been around for some time, and I guess they've sort of learned along the way. But primarily, a lot of the startups that we have tend to have a healthcare person, not necessarily a doctor, but the healthcare person. But it's interesting because you can't really know how invested or how involved that person is. It might just be a face, because it's possible. It could just be a face, like on a founder's team, we have a doctor, and that person has no idea what the office is, has no idea what they're doing or how their business model works. But that exists. And for the code of conduct, I think I can only use our company as an example. And there are so many things that we also put into place because of what exists as our MDCN code of conduct or our ethics book that we have to follow, just because we know it off the top of our heads. As doctors, I said things you don't do, said some of the things you don't say, said some of the things how you act when you're speaking to or interacting with someone who has come to you for help, things like that. And I think while we're building that, we're able to put that into perspective and put that into the fabric of our company. But I don't understand, and I don't know how important that is to other people. But for us, it was a very important key to how we built the company.
Yeah, that's great.
The
Thank
platform
you.
itself.
Thank you. So Melissa, same question as I originally asked. Wale, you're obviously in a sort of rather ideal environment, but what are the top 3 things you'd say? Of course, Zipline's going to move. You're now in Ghana. You'll go to other places and you'll find a less, rosy kind of set of things. So what would you say Zipline's top 3 priorities would be for regulators and government?
So actually, before answering that question, like what do we request from the government and the regulators? Actually, I will actually challenge also like the operators first. As Cynthia mentioned before, there's so many things, and they also rely on our guidelines as operators to kind of like work with us. So as an operator, what are you building? Like, what are your targets? What are you creating, and what type of solution are you bringing to the table? You having that, I would say, baseline, because at the end of the day, you'll be the one working the most and making sure that your counterpart, which are the regulators, understand what you're trying to bring on the table. No one else will do it for you. So I would say that, yeah, definitely create something that bring a real solution, depending on the challenges that are on the continent or any other place in the world. But here we're mostly focusing on the continent, African continent. But also, the second thing I will also say, because we're talking about health technology here, which I understand that it's for a good purpose at the end of the day. So once that technology is there, the only thing that we would request from the regulators is to basically have that, basically having that system or process in place to kind of like enable that technology to operate. So you've talked about Rwanda and how amazing, like everything is set here, but you'll be surprised on how tough the regulators are. So you still need to convince those people. Trust me, it was a long journey between having a drone regulation to having a drone regulation performance-based. It was a long journey, and regulators had to understand that there's a lot of challenges that also, yes, we're bringing solutions, but there's also a lot of challenges that come from the operator's side, and only the industry can teach the regulators. The second thing that also other operators will need to understand when it comes to regulation, not only are you educating regulators, but also your community. So we do have a lot of community engagement, because you cannot start using a technology, even if you're trying to help people. At the end of the day, people need to understand how you're trying to help them. So like for us, we go around different areas in the country and explaining what we do, what your issue that you had with the blood, and how we have like small planes in the air transferring blood, because so that is a huge work that is also that we also need to think of as operators in order to influence regulation that are in the country where we are. And of course, when we're talking about aviation, we also need to also think about national security, any military operations in the air. So community engagement also include like other airspace users. So like the whole ecosystem basically. So you need to understand that you'll be the one making the education and making sure that things are changing. Oh, I was about to say something. I think I just lost my train of thoughts. Yeah, I think that would be that's what I would say. And something else that by process and procedure to put in place to help that technology, as many people have mentioned it here, is basically having those technical committees to kind of follow up on things. Also steering committee, like Daniel had mentioned it earlier on as well. But also as operators, we're actually building a drone association, a Rwanda drone association that has basically, it's hard, like it basically includes anything robotics, artificial intelligence, and part of the robotics, the drones come in. But we feel like having one voice usually is better in influencing the regulation, and the regulators are also more open to when it's one voice instead of like each company coming with different issues. And most of the cases we do realize when we're together, when we talk to different drone companies, is we have the same issues. Like for example, yes, you're gonna introduce yes, we have different requests, but at the end of the day, you realize that we all have the same issue, which is like how long the process might take to kind of have like someone signing or like an approval from a regulator. So having that voice as an association is basically, it's something that the Ministry of ICT has already done with other sectors. And the drone association will also be one of those associations that will be added in terms of like influencing the regulation in place in Rwanda. Yeah.
Thank you. That's great. And I'm sure that's something Daniel will be very happy to hear about. I'm just going to finish up last couple of questions here before we open up to the floor. And I just want to ask Ridwan, obviously you're a lawyer and, you know, African law and tech, we always have an eye on the law side of things. I wonder what you think that the role that lawyers can play to influence and contribute to effective legislative frameworks for health tech. I think, I mean, you're coming from the data protection side of things, so obviously that comes quite naturally in terms of looking at the wider innovation world, but many lawyers are still very much looking at their own sort of narrowly at practice and what they consider to be the kind of day-to-day work. But what more can they be doing actually to create, to influence the wider frameworks for health tech development?
Right. Yeah. So, I mean, I think the first thing that is actually very cardinal in the entire process is that learning process has to be there, in the sense that as lawyers, we can't make intervention if you don't even understand what you're trying to do. Wale has put out a very good case, the challenges, what they actually face. But the truth is, you'll probably not even be able to make sense of what Wale challenges are, except probably the bureaucratic aspect of it, if you don't understand Wale's business model, and if you don't understand the technology that underlies Wale's products. So as lawyers, I need to go outside my comfort to understand what telehealth is, to understand the application of artificial intelligence, of machine learning in healthcare, to understand what predictive medicine is. I need to understand all of these things before I can know how can I make policy intervention. So also it goes beyond, oh, I mean, you just want to do everything. You need to, I mean, this is where having specific knowledge of specific space comes into now. You can't just be the one, I mean, you can't be a snake oil solving every problem. You have to have specific knowledge of different domains. So if it's policy that you want to do, you need to understand how governance works. You need to understand how the research bit works. You need to understand how Wale's business, for example, how many other things does it intersect with. So whether you're looking at, and I'll use data protection, for example, because I mean, that's my own domain. So if you understand data protection bit of Wale's business, it means you need to understand the privacy program aspect of it, the information and governance aspect of it. You need to understand the security aspect of it. So it's not just the knowledge of the law that would actually that will give you all the solution. So if you really want to make impact, you want to make intervention, you need to understand the product, the business model, the technology that drives it. So all of those things cannot work without isolation. And of course, engaging government is a completely different ballgame. It's something we've been trying to do as well on so many ambits. So I mean, there's a lot of roles for lawyers to play. For example, when government issues an exposure draft, for example, that's where I expect lawyers to come in. I mean, engage the businesses, know what their concerns are, and of course, see how you can actually make intervention on their behalf by making recommendations to the regulators, for example. I mean, that's in the instance where we have a draft exposure, because often than not, you just have a regulator, whatever it is that is driving them, they just sleep one day and just throw it out there in the domain. No consultation, no engagement with the stakeholders. But in instances where there are engagements, I mean, these are places, I mean, these are spots where we need to like stand up, understand what's happening on the other side for the businesses, what's really in it for them, for the wider society, from human rights point of view perspective. For example, how do we protect the general interest of people? And of course, safeguard businesses who are probably going to interplay too. So government relations is a different ballgame. It's I think it's a specialty on its own. But beneath that also, being able to work around policy also means being able to understand what you're trying to even advocate around. So also there's also the advocacy bit, whether you're doing it through the court system, whether it's a subtle approach where, I mean, like for us, we prefer the subtle approach where we try to offer a solution rather than just criticize. So we put out the solution out there, whether it's developing a guide, whether it's developing some sort of guidance that could be like a reference point to the regulators. And of course, when you put out documents like that, make sure you engage the regulators. Fine if they take it, fine if they don't. But I mean, efforts should be driven around doing things, because you can't just blame regulators that they are engaging blindly. I mean, from my own experience having to work with regulators around some key focus areas, I understand that the truth is you can't give what you don't have. And honestly, when these people, when they try to like put together some of these things, they don't know more than, they don't see past their shades. So it's when you come in and you're like, oh, you can do this, you can add this to it, avert your mind to this. That's where they sort of broaden their perspective. So we need to have that ongoing conversation like we're having right now, ongoing engagements like we're going to have beyond this conversation, to be able to actually make that much of an impact. Yeah.
Fantastic. Thanks very much, Ridwan. Daniel, over to you. I know you've got lots of thoughts and very creative ideas around how, how the health tech sector plus the legal, regulatory, government can be innovative in terms of creating the appropriate regulatory frameworks. Can you just give us your last thoughts on that, please?
Yeah, you really hit the nail on the head there with innovative. Emerging technology in itself has really blurred the lines between traditional practices. And the result is that you end up having competing regulators. And Melissa really hit the nail on the head there with how she has to deal with aviation as well as health for Zipline. And the results is that we need a much more collaborative regulatory environment. And we also need to innovate within regulation itself. And there definitely are examples of this. Regulatory sandboxes have been used to quite successfully across the continent. In South Africa, we used it in the fintech sector with the Interdepartmental Fintech Working Group. And the idea behind a regulatory sandbox is quite a smart one. You create a safe space in which an innovation can be displayed and can be showed and tested, and the regulators can assess its impact on the environment without the innovator him or herself suffering consequences for breach of regulations. And I think the next big thing that's really come out, which has been touched on, is the diversity of digital technology, and it requires the meeting of multiple different skills. To develop health tech does not only, it can't be done in isolation. You require the development of infrastructure, you require the development of skills and education. So already in just trying to provide a safe space for health tech, you are having multiple sectors that need to come together and provide a way forward. And I really like the example of the drone body that Melissa's put together, because that's another example of a smart regulatory approach, is the adoption and establishment of sector bodies. And these sector bodies can then draft a set of guidelines, draft a code of conduct, a position, and take that before a regulator and just get it approved, get that stamp. Then the regulator itself doesn't need to draft the whole thing from scratch and go through the whole process, which can take years. It simply assesses the existing code of conduct put together by a collection of stakeholders. That's a really smart idea, and we see that in play sometimes around the continent, but it's definitely not the main example. Unfortunately, in Africa, regulation really is more of a command and control, where government sets the standard and people have to come in and meet that standard. But then the issue is when the standards aren't set, it stifles innovation, where government rushes to now set the new standard instead of allowing the sector to set the standard and government approve it.
Thank you, Daniel. Absolutely, I agree with that. And actually, we've seen some kind of sector bodies coming up, little sector bodies coming up. So there's some around blockchain in particular who are trying to bring together, there's one in Nigeria that's a member of the Alt Network actually, who bring together all the different entities that are using blockchain for all sorts of things, to have a collective voice so that they can, together be able to lobby and that sort of thing. I think that does make a really big difference. So I'm just going to leave the last 5 minutes to ask for any parting thoughts, just a sort of 1 minute summary of what you want to do of your thoughts on what we've discussed today. What we are going to do, and I know this has come up very strongly from all of you, is is to have some sort of platform that we can, having a combination of people, both from this webinar and the next one, I think we'll pretty much have represented from across the continent, which is wonderful, and having these voices coming from different perspectives. And I'll say a little bit more about that at the end, but I'm just going to start with Yara and ask you for your 1 minute last thought, and I'll then look at some questions after everyone's spoken.
Yeah, I think this discussion has really driven the point across that we need leadership and strategy from the top in order to foster creativity and innovation from the creative minds out there, and to really benefit the users in the country. So I thought a lot of your examples were really interesting. Thank you so much for sharing.
Thanks, Yara. Cynthia, over to you.
Yeah, this has been a great session. I think for me, the call to action is now. I'm really looking forward to engaging with the panelists on this call, and even beyond that, to drive the discussions and advocacy to putting some of these structures in place. So thank you so much for the opportunity.
Thank you, Cynthia. Thanks. Wale, last thoughts from you?
I cannot overemphasize the need for leadership, regionally, country-wise, nationally, and just continentally, I guess. But obviously, it has to start nationally and then sort of cascade into a more regional and continental-wide approach. But yes, I cannot overemphasize the need for leadership, the need for stakeholder engagement, either as businesses or even between businesses and the government and different governmental agencies. And because a lot of times, a lot of us are, small-time businesses hoping for scale and growth. And they're like the older existing ones that have sort of pivoted into the space or something like that. There's a need for that collaboration, that conversation, not necessarily in terms of your business model or your ideas, but at least in your representation towards the government or at the government conversations. So yes, leadership across board is basically what I'm hoping that, over the next couple of weeks, months, and years, something that would develop and sort of change the narrative and support the conversation going forward. Thank you. And yes, thank you for having me on this platform. Yeah.
Pleasure. Thank you, Ali. Melissa?
I'm going to keep emphasizing on the cooperation and collaboration between the different industries and regulators, and even beyond that, across like countries. Like, for example, like the fact that we're able to what we learned here in terms of drone association, in terms of drone regulation, was able to also help in Ghana when we were going there as well. And learning from each other can also help and create and build a better future for the continent.
Thanks very much, Melissa. Ridwan?
Yeah, thank you for putting this together. For me, collaboration is going to be very key, and part of, I think, having this conversation itself, it's the first step. We need to draw pretty much awareness. We need to draw awareness to this, all these gray areas we've been talking about, because often they're not, in as much as the regulators sometimes are unwilling, sometimes they don't even understand some of these things too. And if you don't understand something, you pretty much, it's so far away from you that you probably not even make sense of it. So we need to continue to engage, have this conversation. And I think moving on from this, I think we need to, using the ALT platform or collaboration with everyone who is currently on this panel and probably the subsequent one. We need to do something together. We currently have something in place in terms of doing guys working on we did a working paper with ALT the previous month. So also I think it's something we should take forward. And Cynthia, I think it's about time to work on the digital health policy. Yeah. So collaboration, engagement. Let's keep this going.
Brilliant. Yes. Thanks, Ridwan. And Daniel, last but not least, please.
I think a discussion definitely needs to be had on innovating regulation. Yeah. And I'm not going to be the guy to say I have the answers. It's an emerging sector, and well, the very nature of emerging technologies is that they're new. And the approach that we have in regulating them needs to change. What we have in place at the moment isn't working. I think that's been revealed. And even in Rwanda, the shining example in Africa, Melissa did highlight that there were indeed areas that could be improved. So yeah, a discussion needs to be had on how we change how we regulate technology and innovation within regulation.
Absolutely. Thank you very much. I'm just going to read out a couple of questions or questions that have come in, and then we can I'll tell you who they're directed at. So there was a question to Wale. Has Wellvis received any positive response from the Nigerian government?
Well, I think we have. We're working with the NCDC. It was I like to call it a B2G approach for us, even though there was no financial incentive. But we were able to sort of create that and offer it to them. And we're thankful that they're using it and they're getting users to get on that platform and also reach the NCDC through that. So yes, I think we have gotten feedback from the Nigerian government, but we're looking forward to having more conversations. Hopefully this is a sort of like an entrance into that conversation or into more conversations between the Nigerian government and state governments and other smaller MDAs, agencies or ministries or departments. And we're looking forward to having more of those kind of conversations. Yeah.
Good, that's great. Question from Melissa. What's the span or the reach of Zipline services? Do you use some sort of hub and spoke model with the drones operating only at the spokes, or is it only in specific areas that you operate?
Yeah, so we are basically doing rural areas, and from our distribution center, we're able to fly. We cover basically a radius of 80 kilometers. And a small country like Rwanda, 2 distribution centers are enough, but in Ghana, we already have up to 3 distribution centers and will be increasing the numbers. And again, all that comes with, depending on what, we are there to support the Ministry of Health. If we're even able to do 12 distribution centers in a country, we will. So it all depends on the strategy of the Ministry of Health and our collaboration with them.
And how much does it cost per Zipline delivery?
Of course, that is it's a contract between the company and the government, and each country is different. So in the case of Rwanda, we have a fixed cost per month that I would not be able to disclose, unfortunately, but definitely it's something that is cost efficient as well.
And a question as well from a familiar name. Even if leadership needs to come from a national level, what can multilateral agencies like WHO or donors like the World Bank, etc., do to increase incentives for governments to act? Now, I guess this is sort of Yara and Cynthia's territory. Cynthia, go for it.
I'll take a stab at it, and then Yara can also add her perspective too. I think the WHO in the last year has made a concerted effort to engage with governments to share more about the digital technologies that are out there. They've been doing a lot of exercises, workshops and meetings across the continent, even I would say the world. The digital health team that is focused on digital health for the continent is based out of Congo, Brazzaville. And they are the ones who are supporting African countries to deal with their e-health strategies, review their strategies if they don't have, look at architecture and so on. So far, it's more of, this is what is available to you, but the now nitty-gritties and practicalities still remain a gap into the responsibility of the countries that they are working with. With World Bank, so from my previous experience working with the World Bank, a lot of digital health activities are done on a needs basis. So it's the government who says, I need money to do this. and then you write a proposal and you see how it goes. So they don't necessarily incentivize or encourage or those type of things, or it's a bank. So basically the way the construct of how a bank operates, that is what they also do. And then they also have a research arm. So it's not really the purview per se of the World Bank to engage or create incentives for them. It's really down to political will. And quite frankly, the individuals who we engage with, not to think of ICT as a cash cow or a back, payment for whatever they're doing just to get you where you need to get into the door, to get that permission to do what you need to do. So it's really down to political will. It's really down, and even if I even go back to WHO, unfortunately, maybe now because of COVID, they've had to open their scope of people that they work with. Prior to this, as of December, there was only a certain group of technologies they were aligned to, and Yara will confirm it, that they were only looking at a specific set because in their minds, because it was open and and had some frameworks defined by the donors, it wasn't really, engaging broadly with other people who could contribute or provide solutions that are more contextualized to the local context. But now, in light of these new revelations or things that are happening with COVID, it has opened the door, but it still remains to be seen whether some of these technologies will be brought on. Maybe to the World Bank point, they had, come up with some innovation space called the Tech Emerge program in East Africa, where they had been engaging with the private sector, companies or vendors to link up to businesses that provide health services in the private sector, and then also bring in expertise to bring these pieces together. And that's an ongoing program that's just started. So some movements, but it's still early days.
Yara, do you want to add on to that?
Yeah, sure. I absolutely agree with Cynthia that it's not the WHO or the World Bank's job to foster that need. I think leadership needs to come from political will in these countries themselves. But I do think that WHO, for example, is a leader in creating frameworks, and that's something that they could work on, like mobile health and e-health frameworks that could foster collaborations with like the judiciary and the regulatory frameworks. I think being able to create that space where there's an environment for things to happen in country, I think that's what they could focus on and really make a big difference in.
Thank you. We have a question from Christina from Alt Network, which is, have any of the panelists identified a country outside of Africa that may be developing a good regulatory model in terms of fostering collaboration and innovation, or is this actually a global challenge?
Yeah, I'll take a stab at that.
Yeah.
So my focus, of course, is on Africa, but one country that I've come across in my own research that's doing an incredible job is Singapore. They're regarded as a world leader, although they are also not, they also have their own challenges, and it is indeed a global problem. But in Singapore, they do have a regulatory sandbox for health tech, and it's the Licensing, Experimentation and Adaptation Program. And they invited a variety of different care providers, health tech companies, and business models to participate in the sandbox. And if you weren't invited to participate in the sandbox, you could still provide comments on the findings of the sandbox. So they have definitely applied some regulatory innovations to answering the question. But yeah, I don't know any other country outside of Africa and Singapore.
Any other examples from anyone else? No?
Maybe just to say that in the United States, in as much as they also had telemedicine laws in place, it was also a constant struggle to engage providers to take up that. And even if they did, there were always these challenges around medical legal issues. And it is only the night of COVID that actually brought them rushing to bring out legislation, adapt it, update it, and those type of things. So they are too also going on their learning journey. And I think it'll be an interesting case to watch, given the severity of what is happening and how they also have to change their healthcare model to accommodate what is happening. I think that would be an interesting case to watch and see how that could be contextualized. But I'd like to encourage panelists and those who are listening out there. I think there will never be a gold standard in terms of who is doing the best and what. And I think it's for us to really take the time to engage with whatever is happening in the country, regionally, across, from region to region, SADC, EAC, ECOWAS, and engage at that level. Start fostering those conversations between the regulation bodies. There will always be people who will do faster, better, smarter, whatever out there. But on our continent, it's high time we took the time to start looking at what is specific to our needs instead of always looking outside.
Right. There's a suggestion of Thailand also being a good a model, Thailand. So that's one to look at. Question for Wale. How open are the health tech companies to partnering with health tech firms from European companies?
If I'm to speak as Wellvis, one, we're open to having those conversations, and if our plans or models are aligned, then we're open to having those conversations and partnership. However, I also wear the cap of a director at the Digital Health Nigeria group, which is basically just a collective of practitioners and enthusiasts and one or two people from regulatory bodies, but they don't represent those bodies, but they are there and they give us insight. And together with Techcabal, interestingly, we created a landscape document, I think about a year or two ago, which sort of provides information around the guys that are playing in the space. And I think one of the things that we found out during that was everyone was open to collaboration, but it was interesting that people were more open to collaborations from outside the country than within the country. I guess that fear of someone jacking your idea or your model or your whatever, it was because we're all just playing, just trying to figure things out. And it made more sense to sort of partner with someone who sort of you might think has figured it out. So I think primarily a lot of Nigerian companies, tech companies, are open to partnership. And if whoever that asked that question, if you're interested, you can reach out to Digital Health Nigeria to kind of create some kind of introductions to people that you might be interested in speaking to, either as companies or just as individuals that might sort of point you in the direction that you need. But yes, I think to answer that question, yes, they are quite open to having those partnerships and those conversations.
There's a follow-up actually to that question, which is what are the challenges and enablers that make market entry easy or difficult for foreign health tech offerings?
So for enablers, again, if you find a partner who's already existing and who's doing work in Nigeria, they can, for a lack of better word, adopt your model or style or whatever, and then just act as your company in Nigeria or as a partnership in Nigeria. Or help you set up your own business in Nigeria if required. But again, and then some of the things that do affect your opportunity or the chances, it still goes back to bureaucracy and all sorts of red lines or red tapes that would be existing based on what country you're coming from, what model your business is using, or who your funding partners or your some of the other partners are. They might just not be interested in you coming into a particular country, or there might be some other political reasons that I may or may not be aware of. So I think, first of all, just finding a person on ground, preferably a business that exists, or a consultant who might have an idea of what's going on ground. It may be a paid or not paid situation, but at least have those conversations and see, they might be able to develop a good market survey document for you, looking at the pastel angle of things. What are the things that you need to get into that market? Create a proper market entry document, and then you can then start to address them one by one and see if there are actually things that exist or things that you might be able to find a way through some of the other partners to navigate. Yeah, so I think there existed all sorts of opportunities that you might be able to take advantage of if you're interested in really going into that new market, at least for Nigeria.
Yeah, I think Melissa mentioned earlier the Rwanda's openness to sort of proof of concept sort of entities coming in and trying things out. So that certainly sounds like a good one. And I'm assuming South Africa is similarly open in terms of foreign health tech providers entering the market. Daniel, do you have a thought on that or any knowledge of that?
Yeah, I mean, we do have the strategy in place. We do have the telehealth guidelines in place from COVID, but as discussed by Cynthia, the telehealth industry took a massive knock just a few years ago and almost fell apart in South Africa. So there are attempts to encourage innovation in South Africa, but we haven't seen any massive regulations established or health tech companies coming out of South Africa.
Mm. Okay, good.
Maybe if I can add, if you're a foreign party or an international company looking to come in as much as you are also partnering with the local entity, find problems that solve mass problems. So, are you able to do services for bottom of pyramid, middle income, not even middle income, just the low quintile there, you know, places where they do not have the capacity to do it, they are outstretched. And if you have solutions that address that, you will get a listening ear. If it's something that's really, really commercial, and that's the truth, and this is what I even advise other entities who have asked these questions, that when you are coming in, please know you're also going to have to do some heavy lifting as well. It has to be something, if you're going to do purely commercial, your target market is going to be very thin. And that's also where even the politicians who you are presenting to, or the officials you're presenting to, think even start competing with them in some instances. Even here in Ghana, that is what is happening. So please, as you come forward, look at big problems, you know, they call it the wicked problems that can be addressed in partnership with your local entity. I always encourage, share with a local entity, don't be afraid, even amongst local organizations. Yes, and I agree with Wale, there is this fear, even if it's a small piece of code, they will hold on to for dear life. You can offer them money, you offer them equity, they will not budge because they think that their local little product can, you know, do a whole thing. But so essentially, yes, they, you know, have all these things at the back of your mind as you come in.
Fantastic. Thank you, Cynthia. I think we've exhausted all the questions that have come through to us. And yeah, I'm just checking. Yep. Oh, hang on. Somebody's come in with one last one. Okay. Telehealth covers diverse elements from administrative aspects to do with doctor's appointments, to information provision, to actual doctor-patient interactions. Data privacy requirements as telemedicine moves towards the latter. Is it realistic to expect service delivery in the next couple of years? I don't know if that's, is that sort of, so if, as we move from from the administrative type of telehealth issues to more the kind of actual doctor-patient interactions, the data privacy requirements will change. Oh, right. Thank you, Florentine. As in, would data privacy regulations allow for actual doctor-patient interaction? I think I'll ask. Doing
it with WhatsApp.
Sorry?
People are already doing, I'm saying,
people are already doing things on WhatsApp.
Before the data protection came out, we were doing it on WhatsApp, right? Yep. People don't even know that you can't use external commercial products to run a telemedicine service. these are even the fundamental aspects of it. Some of the things even the regulators don't know about. People are using Gmail. You know, I got into a project where they were doing passing radiology slides over Gmail. They had set up a full Gmail account, and there were 3,000 cases on it. So I mean, for me, the regulation, it's already happening. It's there. Our job is to really now engage with all these parties and say, let's put some structure. And to Melissa's point and Wale's point, form these associations or these groups that can start generating the documents that you can put in front of a regulator before they catch wind of it. They are aware, but it's just, they've just been keeping quiet and again, waiting for an incident to happen. So I think it's very important that we start, generating those conversations and documents that we can take to the regulator.
And I think one of the issues, especially in the data privacy point, which Ridwan also mentioned earlier, is apart from having very few countries with data protection laws, there are even fewer authorities that have been set up or enforcement agencies. So even if there was a law that prohibited that, it would be rather difficult to to have any enforcement of it. So actually engaging is really important. We have a couple of points again that have come into the Q&A. Brazil and I think Kenya managed to remove restrictions on telemedicine on a temporary basis because of COVID. This suggests that now might be a time to make the case. And then a second comment is, and the case is to make such temporary measures permanent. Well, that's the suggestion, is that this might be a time to make temporary measures, to make those measures permanent and remove restrictions. And hopefully that will be considered that way. And the other point is, thank you for this very crucial conversation. I know of most US health tech companies being HIPAA compliant. I hope you guys know what HIPAA means. Though we don't have a framework yet in Africa, ICT and broadband penetration has been largely one to worry about. If you have seen the eHealth plan for 2015-2020 developed by the Federal Ministry of Health and the NIDDA, I imagine this is a Nigerian one, they have a framework that is heavily internet dependent. How feasible would this be for the lower pyramid occupants? Please, Wale.
All right, so yes, I have seen the document from NIDDA, and also to add to the conversation around the companies in the US that are HIPAA compliant. It is, talking back to the document, it's one of those things that's clear that the stakeholders, there were a level of stakeholders, there were stakeholders that were engaged, but depends on who those stakeholders represent. Yes, it is very internet dependent, but the other options, there are not a lot of other options, to my opinion or to my knowledge, that would work for Nigeria as it is right now. Our internet is very, there's not a lot of things you can do via USSD or any other offline models, but as far as I'm concerned, I think the document, again, is 2015 to 2020. The document needs to be reviewed. There needs to be a lot more input from various kinds of stakeholders, from the medical aspect of things to even, lifestyle type of stakeholders that would engage the people who put the document together and continually evolve and improve on the document. So yes, it is internet-based, but I think, to the best of my knowledge, I don't see a lot of other options right now that would work for Nigeria besides that. Or if you're going to then do maybe phone calls or things like that, it's still going to need to go through an internet protocol of some sort. So yes, it is internet-based, but I don't think there's much that could be done about that at this point.
Thanks, Wale. Cynthia, do you know anything about any other place that has removed restrictions on telemedicine temporarily on the continent in response to the comment that was made earlier?
No, it's correct. It's Kenya and the other country, and South Africa. My knowledge, Kenya and South Africa. Okay. Other countries don't necessarily have even the e-health policies. In some countries are even as old as 2010, 2008. Mm-hmm. And even in light of what was interesting about Ghana, for example, was that even at the height of what was happening, not many, I mean, private individuals as health practitioners were doing their own thing, but there was no massive response from the government to say, this is what we're going to do. It was all call center based, your standard call center. So there's not been any, aside from those two countries, but they did, I think I've been following the Kenya one particularly closely just to learn how their process went. And it was really being pushed from the Kenya Health Federation, who really drove the conversations and put the pieces together, and brought the tech people, brought the regulators, and they themselves as health practitioners to the table to make this expedient policy come out. So that's an interesting case to learn moving forward.
Yeah, a good example of collaborative sort of building a coalition that can actually get the job done. That's great. Thank you. I'm going to draw this discussion to a close because we're hitting our time, but also we have no further questions that have come in. Can I just thank our panelists so much for your time and your insights and for making this such an enjoyable conversation. And obviously we could go on forever, which is kind of one of the reasons why we decided to have a two-parter on this topic, because there's so much to discuss. And thank you to our audience for your engagement and time as well, and going the full length of it with us on this. I think it's been a really brilliant one. As I said at the beginning, this is the first of two webinars. The next will be on the 16th of July, and we will send information out to all of you in the next week or so. Thank you for taking part. Thank you to our media partners, Techcabal. Actually, Wale mentioned a health tech report that Techcabal did, which he contributed to, and that's available, and we can also circulate that to, and it's kind of the state of health tech in Nigeria specifically, which we can pass on to all of you who are interested. Please, for those of you who are not members of the Alt Network, do join the network for news, information, events, and resources on all issues at the intersection of law and technology in Africa. We're at www.alt-network.com. I look forward to continuing this conversation, and the panelists for giving us that sort of drive and impetus to keep this going, and we will. Yara, thank you for doing a very early morning for us today, and I really look forward to continuing this conversation with all of you. Thank you so much, and we'll be in touch.